Hi, welcome to Ask Dr. Tan. This is a series where we take all your questions from the web and then we try to answer them the best we can. And this week, we're going to talk about syphilis. Okay, so the most common question we got was, what is primary, secondary, and tertiary syphilis? Okay, this is extremely confusing. Even for doctors, it's very confusing. So primary, secondary, and tertiary syphilis actually describe the symptoms of syphilis. So when a person gets infected with syphilis, after 9 to 90 days, that's like a week to 3 months, he or she develops a painless ulcer that's called a chancre, usually at the point of infection. So this is called primary syphilis. Now, with or without treatment, this ulcer disappears, and about 6 weeks later, the patient will break out in a rash, usually involving the body, especially the palms and the soles. And this is called secondary syphilis. Again, with or without treatment, this rash can disappear, and it can actually come back a few weeks later and then disappear again. A lot of times it's misdiagnosed for things like allergies, right? So it's also not a great imitator. And then many years later, the patient might develop tertiary syphilis. That's when it attacks the nervous system and the heart, and it gets really serious. So primary, secondary, and tertiary syphilis refer to the symptoms of syphilis. In between, when the patient doesn't have any symptoms, it's called latent syphilis. Second question, what are the treatment options for syphilis? Well, honestly, to doctors, there's one treatment alone, and that is an injection of a long-acting penicillin, also known as benzathine penicillin. If a patient is allergic to penicillin, we can consider other antibiotic options, but none of them are as good as penicillin. So penicillin is really the only option. And the last question is, how long is the follow-up? Okay, this is an unequivocal answer. It is 2 years. Okay, you need to get a blood test for syphilis, looking for the syphilitic titer, which is kind of like, you look at it roughly of how much of the bacteria is in your system. 3 months after the treatment, we need to repeat this test to make sure that the amount of bacteria has come down. 6 months later, we repeat it again to make sure that it stays down. And then at a year and a half, and at 2 years. So a patient who is diagnosed with a syphilis infection is followed up for no shorter than 2 years to make sure that it is fully treated and it won't come back. Alright, that brings us to the end of this episode. See you guys next time.